Have you ever watched a loved one struggle with a fall or felt your balance waver as you navigate your daily routine, wondering if it's just an inevitable part of aging? If you're a woman in your 70s or 80s, or care about someone who is, you might be surprised to learn that 99% of women in this age group lose their balance not just because of age, but due to 5 critical, yet avoidable mistakes. Falls are a leading cause of injury, costing millions in healthcare and robbing countless women of their independence. But the good news is that you can take control and dramatically reduce your risk. In this video, we'll dive deep into these 5 common pitfalls, from neglecting strength training to overlooking simple home hazards, and reveal practical, science-backed strategies to keep you steady, confident, and active. You need to watch until the end because we'll share a powerful, easy-to-implement tip that could be the key to preventing falls and preserving your independence for years to come, empowering you or your loved ones to live life to the fullest. Before we begin, I would appreciate it if you like this video. You can help me continue to spread the old age lesson. If you haven't subscribed yet, I recommend you subscribe and turn on the bell so you don't miss any videos. If you like this video, please comment number 1. If you don't like it, comment number 0 to let me know, so I can make a better video for you. Now let's get started. Mistake 1. Neglecting strength and balance training. As women age into their 70s and 80s, one of the most significant contributors to balance loss is the natural, age-related decline in muscle mass and strength, a condition known as sarcopenia. Starting in the 30s, adults lose approximately 3 to 5% of their muscle mass per decade, with this rate accelerating to 1 to 2% per year after age 60, particularly in those who lead sedentary lifestyles. This muscle loss is especially pronounced in the lower body, quadriceps, hamstrings, glutes, and calves, as well as the core and hip muscles, all of which are critical for maintaining stability, coordinating movement, and recovering from sudden shifts in posture, such as tripping or turning quickly. Weakness in these muscle groups impairs the body's ability to stabilize itself, significantly increasing the risk of falls, which are a leading cause of injury and loss of independence among older adults. According to the Centers for Disease Control and Prevention, CDC, falls are the primary cause of injury-related deaths and non-fatal injuries for adults aged 65 and older, with women being particularly vulnerable due to lower baseline muscle mass compared to men. Many women in this age group mistakenly believe that physical activity becomes less important or even risky as they age. Fears of injury, joint pain, or worsening existing health conditions often lead to a sedentary lifestyle, which accelerates muscle loss, weakens bones, and diminishes proprioception, the body's ability to sense its position in space. Additionally, societal stereotypes about aging can discourage women from engaging in strength or balance training, as they may perceive such activities as inappropriate or unnecessary for their age. This mindset creates a vicious cycle. Reduced activity leads to greater muscle loss, poorer balance, and a higher likelihood of falls, which in turn reinforces fear of movement. Compounding this, many assume that light activities, such as occasional walking, are sufficient to maintain strength and balance. However, without targeted exercises, these efforts fall short of effectively addressing sarcopenia and reducing fall risk. How to avoid it? To counteract sarcopenia and maintain functional strength, women in their 70s and 80s should incorporate strength training into their routines at least 2 to 3 times per week, as recommended by the American College of Sports Medicine, ACSM. These sessions should focus on major muscle groups, particularly the lower body and core, which are essential for balance and mobility. Effective exercises include squats or chair stands to strengthen the quadriceps, hamstrings, and glutes, improving the ability to stand from a seated position or recover from a stumble. Lunges or step-ups enhance leg strength and coordination, mimicking everyday movements like climbing stairs, while core exercises like seated leg lifts or gentle planks, with support, stabilize the torso during movement. Beginners can start with body weight exercises, progressing to resistance bands or light dumbbells, 1 to 5 pounds, as strength improves. Each session should include 8 to 12 repetitions of 6 to 8 exercises at a moderate intensity, where the last few repetitions feel challenging but achievable. Consulting a physical therapist or certified trainer experienced in senior fitness is crucial to ensure proper form and safety, especially for individuals with conditions such as arthritis or osteoporosis, who may benefit from modified exercises like seated chair stands or partial lunges with wall support. Balance-specific exercises are equally important and should be integrated into weekly routines to improve proprioception, coordination, and reaction time. A 2016 meta-analysis in the British Journal of Sports Medicine found that balance training can reduce fall risk by up to 50% in older adults. Tai Chi, a low-impact practice involving flowing movements, is particularly effective, with studies from the Journal of the American Geriatric Society showing significant reductions in fall rates due to improved dynamic balance and leg strength. Gentle or chair-based yoga enhances flexibility, core strength, and body awareness, with poses like tree pose, with support, or Warrior 2 adapted for older adults. Simple balance drills, such as standing on one leg for 10 to 30 seconds, holding a chair if needed, walking heel to toe in a straight line, or practicing side steps, can be done at home near a sturdy surface for safety. These exercises should be performed 2 to 3 times per week, with gradual progression in duration or difficulty, such as reducing reliance on support or increasing single-leg stand time. Incorporating balance practice into daily routines, like balancing while brushing teeth, can further reinforce habits. Consistency is critical to preventing muscle loss and maintaining balance. The World Health Organization, WHO, recommends 150 to 300 minutes of moderate-intensity aerobic activity per week for adults aged 65 and older, combined with muscle strengthening and balance exercises. Light activities like brisk walking, even with a walker or cane, gardening, or household chores such as sweeping engage multiple muscle groups and promote functional movement. Community-based programs like Silver Sneakers or local senior fitness classes offer social motivation and professional guidance, making adherence easier. Scheduling workouts at consistent times, enlisting a workout buddy, or tracking progress in a journal can help sustain motivation. For those with chronic conditions like heart disease or diabetes, consulting a healthcare provider before starting a new regimen ensures safety. Additional considerations can enhance safety and success. Each exercise session should begin with a 5 to 10 minute warm-up, such as marching in place or arm circles, to prepare muscles and joints, and end with gentle stretching to maintain flexibility. Adequate hydration and a protein-rich diet, 0.5 to 0.8 grams per pound of body weight daily, as per the National Institute on Aging, support muscle repair and strength. Fall-proofing the home by removing tripping hazards, e.g., loose rugs, installing grab bars, and ensuring proper lighting complements exercise efforts. By prioritizing strength and balance training, women in their 70s and 80s can significantly reduce fall risk, maintain independence, and enhance quality of life, countering sarcopenia while boosting confidence and overall health. For tailored guidance, working with a healthcare provider or fitness professional is recommended to align the program with individual needs and goals. If you are still watching this video and finding these lessons useful, please comment number 1 below to let me know that you are still watching this video with me. Thank you for your valuable time. Mistake 2. Ignoring vision and hearing health. Maintaining balance is a complex process that relies on the seamless integration of sensory inputs from multiple systems, including the visual system, the vestibular system in the inner ear, and the somatosensory system, which provides feedback from muscles and joints. Vision plays a pivotal role by supplying the brain with critical cues about the body's position relative to its surroundings, enabling accurate navigation and movement. Similarly, the vestibular system detects head position, motion, and changes in gravity, sending signals to the brain to coordinate balance and stabilize eye movements. Hearing also contributes significantly by providing auditory cues that enhance spatial awareness, such as detecting the direction of environmental sounds like footsteps or traffic. When these systems function optimally, they work together to ensure stability and prevent falls. However, age-related changes or untreated conditions in these sensory systems can disrupt this delicate balance, increasing the risk of falls, which are a leading cause of injury among older adults, particularly women. As women age, natural declines in vision and hearing can profoundly impact balance. Conditions such as cataracts, clouding of the eye's lens, glaucoma, optic nerve damage due to increased eye pressure, or macular degeneration, deterioration of the central retina, can impair depth perception, reduce peripheral vision, or blur visual clarity, making it challenging to navigate uneven surfaces or avoid obstacles. Similarly, age-related hearing loss, known as presbycusis, affects approximately 1 in 3 adults over 65 and can diminish the ability to process auditory cues, such as the sound of an approaching vehicle, which helps with spatial orientation. Vestibular disorders, like benign paroxysmal positional vertigo, BPPV, can further complicate balance by causing dizziness or vertigo, particularly in women over 50. Despite these risks, many women fail to address sensory changes due to a lack of awareness, denial of decline, or reluctance to seek medical care. This oversight is concerning, as the Centers for Disease Control and Prevention, CDC, reports that over 25% of adults aged 65 and older fall annually, often leading to fractures, head injuries, or loss of independence. How to avoid it. Comprehensive strategies for protecting vision and hearing health. To mitigate the risks associated with sensory decline and maintain balance, women should adopt proactive measures to monitor and manage their vision and hearing health. Regular vision checkups are essential for early detection and treatment of conditions that impair visual function. Annual visits to an optometrist or ophthalmologist can screen for issues such as cataracts, which cause blurred vision, and glare, or glaucoma, which reduces peripheral vision and can lead to blindness if untreated. For example, cataract surgery, a safe and effective procedure, can restore visual clarity and significantly improve balance by enhancing depth perception. Macular degeneration, which affects central vision, may be managed with dietary supplements, lifestyle changes, or injections to slow progression. Even presbyopia, the age-related loss of near vision, can affect balance during tasks like walking downstairs, but corrective lenses, such as bifocals or progressive lenses, can address this issue. Women should discuss balance-related concerns, such as difficulty judging distances or navigating in low-light conditions, during eye exams to ensure prescriptions for glasses or contact lenses are up to date. For those with significant vision loss, low vision aids or rehabilitation programs can help adapt to changes and maintain safe mobility. Monitoring hearing health is equally critical, as hearing loss can subtly undermine spatial awareness. Women should schedule regular hearing evaluations with an audiologist, particularly if they notice signs like difficulty following conversations, frequently asking others to repeat themselves, or trouble hearing in noisy environments. Hearing aids can amplify environmental sounds, enhancing spatial orientation and reducing disorientation. Modern devices are discreet, customizable, and effective, with audiologists providing ongoing support for adjustment. For severe hearing loss, cochlear implants may be an option, bypassing damaged ear structures to stimulate the auditory nerve. Preventive measures, such as avoiding prolonged exposure to loud noises, using ear protection in noisy settings, e.g., concerts or construction sites, and managing chronic conditions like diabetes or hypertension, can also protect hearing health. Regular checkups, ideally every 1 to 2 years for older adults, ensure early detection and intervention to prevent further deterioration. Addressing dizziness and vestibular issues promptly is another key strategy. Conditions like BPPV, caused by dislodged calcium crystals in the inner ear, are common in older women and can trigger brief episodes of vertigo with head movements. BPPV is treatable with repositioning exercises, such as the Epley maneuver, performed by a healthcare provider or trained physical therapist. Other vestibular disorders, such as Meniere's disease or labyrinthitis, may also cause dizziness and imbalance. Women experiencing symptoms like vertigo, unsteadiness, or a spinning sensation should consult an otolaryngologist, ENT, or neurologist for a thorough evaluation. Diagnostic tests, such as video nystagmography, VNG, or posturography, can assess vestibular function and guide treatment. Vestibular rehabilitation therapy, VRT, a specialized exercise program, can retrain the brain to compensate for vestibular deficits, improving balance and reducing fall risk. Integrating multisensory strategies can further enhance stability by compensating for sensory deficits. Environmental modifications, such as ensuring well-lit homes, removing clutter, and installing handrails or grab bars, reduce fall risks, especially for those with impaired vision or hearing. Balance training through exercises like Tai Chi, yoga, or physical therapy strengthens muscles and improves coordination, supporting sensory integration. Regular health checkups are also vital to manage chronic conditions like diabetes or hypertension, which can exacerbate sensory decline, and to review medications that may cause dizziness as a side effect. For women concerned about cost or access to care, community health programs, Medicare coverage, for those eligible, or low-cost clinics often provide vision and hearing screenings. By prioritizing regular vision and hearing care, addressing dizziness promptly, and adopting a holistic approach to sensory health, women can significantly reduce their fall risk and maintain greater independence and confidence in daily activities. These proactive steps not only support balance but also enhance the overall quality of life, empowering women to navigate their environments with greater ease and safety. Mistake 3. Poor footwear choices. Wearing improper footwear is a surprisingly common mistake that undermines balance. One of the most overlooked yet critical factors contributing to falls, particularly among older adults or those with mobility challenges, is the choice of footwear. Wearing improper or inadequate footwear can significantly undermine balance, increase the risk of trips and slips, and exacerbate existing mobility issues. This mistake is surprisingly common, as many people prioritize comfort, convenience, or aesthetics over functionality, especially in familiar environments like the home, where the majority of falls occur. High heels, worn-out shoes, flip-flops, or slippers with insufficient support can destabilize the feet, reduce traction, and fail to provide the structural integrity needed for safe and confident movement. Poor footwear choices not only affect balance but can also contribute to foot pain, improper gait, and long-term musculoskeletal issues, all of which heighten the risk of falls and injuries. The risks associated with poor footwear are multifaceted. High heels, for instance, shift the body's center of gravity forward, forcing the wearer to compensate with unnatural posture adjustments that strain the knees, hips, and lower back. Worn-out shoes with degraded soles or flattened insoles no longer offer the cushioning or grip necessary for stability, while loose-fitting slippers or sandals like flip-flops provide minimal support and can easily slip off or catch on surfaces. Walking barefoot or in socks on smooth surfaces like hardwood or tile floors can also increase the likelihood of slipping, particularly for individuals with reduced sensation in their feet due to conditions like neuropathy. These footwear-related risks are especially concerning for older adults, as age-related changes in foot structure, such as reduced fat padding or weakened arches, already compromise balance and stability. If you are still watching this video and finding these lessons useful, please comment number 2 below to let me know that you are still watching this video with me. Thank you for your valuable time. How to avoid it. A comprehensive approach to footwear and foot health. To mitigate the risks of poor footwear choices, selecting supportive, well-fitted shoes is essential. Opt for shoes with low, wide heels, no higher than 1 inch, to distribute weight evenly and maintain a stable base of support. Non-slip soles, preferably made of rubber or textured materials, provide excellent traction on various surfaces, including wet or smooth floors, reducing the risk of slips. Shoes should also feature adequate arch support and cushioned insoles to absorb shock, reduce foot fatigue, and promote proper alignment of the feet, ankles, and knees. A secure fit is crucial. Shoes should be snug without being tight, preventing the foot from sliding inside and causing blisters or instability. Athletic shoes, walking shoes, or specialized orthopedic footwear are often ideal choices for daily wear, as they are designed to provide stability and support during movement. For individuals with specific foot conditions, consulting a podiatrist for custom orthotics or specialized footwear can further enhance safety. Certain types of footwear should be avoided to ensure stability and safety. High heels, particularly those above 2 inches, disrupt natural posture and significantly increase the risk of ankle sprains and falls. Flip-flops and loose slippers offer minimal support and can easily slip off or catch on objects, leading to trips or falls. Worn-out shoes, with stretched materials or degraded soles, no longer provide adequate traction or support and should be replaced every 6 to 12 months for frequently worn pairs. Indoors, walking barefoot or in socks on smooth surfaces like tile or hardwood increases slip risk. Instead, opt for supportive house shoes or slippers with rubber soles and a secure fit, designed specifically for indoor use to provide better traction and stability while maintaining comfort. Maintaining overall foot health is equally important for ensuring proper gait, balance, and mobility. Regular foot care, such as keeping toenails trimmed and moisturizing to prevent dry, cracked skin, helps maintain comfort and functionality. Avoid applying lotion between toes to reduce the risk of fungal infections. Conditions like bunions, hammer toes, plantar fasciitis, or neuropathy can alter gait and increase fall risk, so consulting a podiatrist for professional evaluation and treatment, such as orthotics or physical therapy, is advisable. Simple exercises like toe curls, ankle rotations, or picking up small objects with the toes can strengthen foot and ankle muscles, improving balance. For individuals with reduced foot sensation due to conditions like diabetes, regular foot inspections and protective footwear are critical to prevent injuries. Finally, footwear should be adapted to the environment. Outdoors, choose sturdy shoes with excellent traction for uneven terrain. Indoors, prioritize non-slip house shoes, especially in areas prone to spills or wet surfaces. For those with limited mobility or recovering from injuries, slip-on shoes with Velcro straps may be easier to manage than laced shoes while still providing adequate support. For individuals with specific medical conditions or a history of falls, consulting a podiatrist, orthopedist, or physical therapist can provide tailored recommendations, such as custom orthotics or prescription footwear, to enhance safety and comfort. By prioritizing supportive, well-designed footwear and maintaining overall foot health, individuals can significantly reduce the risk of falls and improve mobility and confidence. This is particularly critical for older adults, who face a higher risk of fall-related injuries, but applies to anyone seeking to move safely and comfortably in their daily lives. Investing in the right shoes and foot care practices is a small but impactful step toward long-term health and independence. Mistake 4. Overlooking medication side effects. As women age, they are more likely to require medications to manage chronic conditions such as hypertension, anxiety, depression, or sleep disorders. Commonly prescribed drugs, including antihypertensives, e.g., beta blockers, ACE inhibitors, benzodiazepines, e.g., lorazepam, or sedative hypnotics, e.g., zolpidem, can produce side effects that significantly impair balance and increase fall risk. These side effects include dizziness, drowsiness, confusion, or orthostatic hypotension, a sudden drop in blood pressure upon standing that may cause lightheadedness or fainting. For instance, diuretics used for blood pressure control can lead to dehydration or electrolyte imbalances, both of which compromise stability. Similarly, medications for sleep or anxiety may cause prolonged sedation, slow initiation times, reduced coordination, which can make even simple movements risky. The risk is further heightened by polypharmacy, the use of multiple medications simultaneously, which is common among older adults. Taking 5 or more medications increases the likelihood of adverse drug interactions, potentially amplifying side effects like blurred vision, muscle weakness, or cognitive impairment, all of which can destabilize balance. Unfortunately, many women are unaware of how their medications affect their stability or hesitate to discuss these concerns with their healthcare providers. This may stem from a lack of clear communication, the assumption that side effects are inevitable, or failure to consider over-the-counter drugs, such as antihistamines, e.g., diphenhydramine, or sleep aids, which can exacerbate risks when combined with prescriptions. Open dialogue and proactive management are essential to mitigate these dangers. How to avoid it? Conduct regular medication reviews. Schedule a comprehensive medication review with your primary care physician or pharmacist at least annually, or whenever a new medication is prescribed or a dosage changes. This review should encompass all prescriptions, over-the-counter drugs, and supplements to identify potential side effects like dizziness, fatigue, or cognitive impairment that could elevate fall risk. Ask targeted questions, such as, could this medication increase my risk of falling? Or are there alternatives with fewer balance-related side effects? For example, switching from a sedating antidepressant like amitriptyline to a less sedating option like sertraline may reduce drowsiness. If polypharmacy is a concern, inquire about deprescribing, safely reducing or discontinuing medications that may no longer be necessary, to minimize risks. Monitor blood pressure and orthostatic changes. For women taking antihypertensive medications, regular blood pressure monitoring is crucial to detect orthostatic hypotension. Use a home blood pressure monitor to check readings in different positions, such as sitting and standing, to identify significant drops that could cause lightheadedness. Simple strategies can help manage symptoms, such as rising slowly from a seated or lying position. Pause at the edge of the bed before standing or hold steady for a moment after standing up. If orthostatic hypotension persists, consult your doctor about adjusting medication dosages or exploring non-pharmacological interventions, such as increasing fluid or salt intake, if medically appropriate. Limit alcohol and sedatives. Alcohol can interact with many medications, intensifying side effects like drowsiness or dizziness, which directly impair balance. For example, combining alcohol with benzodiazepines or opioid painkillers can dangerously amplify sedation. Adhere to your healthcare provider's guidance on alcohol consumption, which may mean limiting intake to 1 drink per day or avoiding it entirely, depending on your medications. Similarly, steer clear of over-the-counter sleep aids or antihistamines like diphenhydramine, found in Benadryl, which can cause lingering drowsiness. If sleep difficulties persist, discuss safer alternatives with your doctor, such as cognitive behavioral therapy for insomnia, CBTI, which avoids the risks of sedative medications. Communicate openly with healthcare providers. Proactively report symptoms like dizziness, unsteadiness, or fatigue to your doctor, even if they seem minor. Keeping a symptom diary to track when these issues occur and whether they correlate with medication doses or timing can provide valuable insights. This information helps your provider tailor your treatment plan to minimize fall risks while effectively managing your health conditions. Never assume side effects are an unavoidable part of treatment. open communication can lead to safer, equally effective alternatives. If you are still watching this video and finding these lessons useful, please comment number 3 below to let me know that you are still watching this video with me. Thank you for your valuable time. Mistake 5. Failing to modify the home environment. The home, where older women spend most of their time, is the most common site for falls, accounting for over 50% of fall-related injuries in older adults. Familiarity with one's surroundings can foster a false sense of security, causing many to overlook subtle hazards that become significant with age-related changes in balance, vision, or mobility. Common risks include cluttered walkways, loose rugs, poor lighting, slick floors, or the absence of supportive features like handrails. For example, a small step between rooms or a dimly lit staircase can transform routine tasks, such as walking to the bathroom at night or carrying items upstairs, into hazardous endeavors. Women are particularly vulnerable due to factors like lower muscle mass, osteoporosis, or vision changes, such as reduced depth perception or sensitivity to glare, which can exacerbate these risks. Many women resist home modifications due to emotional or practical barriers. Some view changes as an admission of aging or frailty, while others perceive them as costly or disruptive. However, simple, cost-effective adjustments can dramatically enhance safety without sacrificing independence or the comfort of familiar surroundings. By proactively addressing environmental hazards, women can significantly reduce their fall risk and maintain confidence in their daily activities. How to avoid it? Optimize lighting for visibility. Inadequate lighting is a leading cause of falls, particularly at night or in areas like staircases, hallways, or bathrooms. Ensure all rooms are equipped with bright, non-glare bulbs, at least 60 to 100 watts or LED equivalents, to improve visibility. Install motion sensor lights in high-traffic areas or night lights in bedrooms, bathrooms, and hallways to illuminate paths during nighttime navigation. For outdoor areas, such as entryways or porches, ensure adequate lighting to prevent trips on steps or uneven surfaces. If glare is an issue, common with aging eyes, use frosted bulbs or indirect lighting to reduce visual strain and improve clarity. Eliminate tripping hazards. Conduct a thorough walkthrough of your home to identify and remove potential hazards. Clear clutter from floors, such as stacks of magazines, loose cables, or small furniture that could obstruct walkways. Secure loose rugs with double-sided tape or non-slip backing, or consider removing them entirely to prevent tripping. Extension cords should be tucked away or rerouted along walls to avoid crossing paths. If your home has high pile carpets, which can catch toes or impede mobility aids, consider replacing them with low pile carpets or hard flooring like wood or vinyl, which provide smoother surfaces for walking or using a walker. Install safety features. Strategic additions can make the home significantly safer. Install sturdy grab bars near toilets, in showers, and next to bathtubs to provide support during transitions. Ensure staircases have handrails on both sides, ideally extending beyond the top and bottom steps for added stability. Non-slip mats or adhesive strips in showers and tubs can prevent slips on wet surfaces. For those with significant mobility challenges, consider more substantial modifications, such as a raised toilet seat, a shower chair, or a stair lift for multi-level homes. Many of these features are affordable and may be covered by insurance or community programs for seniors. Use and maintain assistive devices. If a healthcare provider recommends a cane, walker, or other mobility aid, use it consistently and ensure it's properly fitted. For example, a cane should be adjusted to wrist height when standing, and walker wheels should be checked for smooth operation. Work with a physical therapist to learn proper techniques for using these devices, especially on stairs or uneven surfaces. Resist the temptation to forego assistive devices due to stigma or inconvenience, as they can significantly reduce fall risk and support long-term independence. Engage professionals for assessments. Consider a home safety evaluation by an occupational therapist or aging-in-place specialist, who can identify specific risks and recommend tailored modifications. Some community organizations or area agencies on aging offer free or low-cost assessments for seniors. These professionals can also suggest adaptive technologies, such as smart home devices, e.g., voice-activated lights or doorbell cameras, to enhance safety and convenience. A professional assessment ensures a comprehensive approach to minimizing fall risks while aligning with your specific needs and lifestyle. By addressing medication-related risks and proactively modifying the home environment, older women can significantly reduce their fall risk while preserving independence and confidence. These practical, often low-cost steps can have a profound impact on safety, mobility, and overall quality of life, empowering women to navigate their daily routines with greater security and peace of mind. And there you have it. The 5 critical mistakes that contribute to balance issues for women in their 70s and 80s, and the actionable steps you can take to avoid them and stay steady, confident, and independent. From prioritizing strength and balance training to making simple home modifications, these strategies can make a world of difference in preventing falls and enhancing your quality of life. So, what have you learned from this video that surprised you or inspired you to take action? Maybe it's the importance of supportive footwear or the impact of a medication review. Whatever it is, we'd love to hear about it. Drop a comment below with one key takeaway you've learned and plan to put into practice in your life. Your insights could inspire others, too. If you found this video helpful, please leave your comment below, and don't forget to like, share, and subscribe to our YouTube channel for more tips to empower you to live your best life. Stay safe, stay strong, and we'll see you in the next video.